Hello, everyone. I'm Fire Chief John Butler. I hope all of you are staying safe as we continue to see the spread of COVID-19 throughout our region. I wanted to take the time to check in and let you know that we are here, continuing to serve our Fairfax County community. Our firefighters and paramedics continue to fully staff all fire stations and apparatus. We're responding to every call and doing everything we can to ensure you and our personnel stay safe and healthy. Our normal work continues, even though it might look a little different. We have closed our fire stations to the public. We miss interacting with residents at our fire stations, but feel this is a necessary step to ensure personnel stay safe and healthy and able to serve the residents of Fairfax County. We may look a little different as we respond to 911 calls. Firefighters and paramedics are wearing an increased level of personal protective equipment, PPE, as we care for potential COVID-19 patients. This includes gowns, masks, eye protection, gloves, and face shields. Do not be alarmed. This is added protection, which ensures that members of Fairfax County Fire and Rescue Department are able to continue providing emergency medical care to those in need. We ask that you help us help you. If you have cold or flu-like symptoms, call your healthcare provider. Please do not visit the emergency room, fire station, or call 911 unless it is an emergency. For example, you're having difficulty breathing. If you call 911, the dispatcher and our responding paramedics will ask a series of questions about your symptoms and medical history. It is important that you answer these questions accurately and completely with as many details as possible, as it allows us to provide you with the care you need and to take the necessary precautions to protect our personnel. We treat all who need our help regardless of symptoms or medical conditions. We ask that you answer our questions to the best of your ability so we can keep our providers healthy and able to serve our community. Be assured we're preparing now so that we can provide consistency in our operations and service delivery should we begin to see an increased calls for service. We hope we don't have to use these contingency plans, but they're ready to go if needed. So wash your hands, don't touch your face, and keep on social distancing yourself. You're not alone. Let's do this together.